The pancreas also gets blood supply. The thing about the pancreas, like every other organ, is if you do anything to its blood supply, which normally might be quite large, if you do anything to its blood supply, that organ will start to die gradually or malfunction. So if the pancreas produces insulin and is not getting adequate blood, it will start to produce faulty insulin and or stop producing insulin altogether. And how can the pancreas start to get less blood? Simply put, you are suffocating the blood supply. How do you suffocate the blood supply to the pancreas? Weight gain. Weight gain makes the blood vessel narrower. Gradually over time, the pancreas starts to get faulty. And the concept of weight gain, depending on your culture, like the culture I come from, there are certain foods we eat because we see our parents eating it. So inadvertently we gain weight. We don't exercise, we don't see our parents exercise. And if our parents are too busy to get us to move up and down, we're always on our cell phones. Inadvertently we will gain weight, and we keep on doing that for over 20, 30 years. So over 20, 30 years, the pancreas is being deprived of blood. It's literally being suffocated, and gradually it starts to produce, instead of healthy insulin, it starts to produce an insulin that is faulty. So instead of making this, it starts to make a bunch of this, until eventually it starts to just make fragments of insulin, or eventually no insulin. So the best way to treat type 2 diabetes is to prevent it. Easy way to prevent it: don't let the fat accumulate. Watch what you eat, be more physically active, get off the phone, talk to people more, make sure you regulate your body weight. Not because there's anything wrong with your body type, no, but for your own health. Now there are some people I've met who they weigh 250, 300 pounds, and it works for them. They're full of a lot of muscle, they're always very active, okay. But you have to determine what will work for you. So please stay active, watch what you eat. And the rule of thumb when it comes to calories is, when it comes to oils, the way it is at room temperature is where it's going to become in your body. So if it's solid at room temperature, eventually it'll start to collect in that same form within your body, either in the blood vessels as lumps of fat or around it. So please, watch what you eat for your own health. And that will be very, very constructive for you. I hear it's like $900 for a shot of insulin for a monthly dose. That's expensive. I'd rather use $500 to buy healthy food than $900 to try to stay alive. All right, thank you.